Hi everyone, this is Dr. Borazi again. So in a Facebook video live, I touched on what I call is the CKD5 clinic, which is the clinic where I address patients who have a kidney function less than 30%. And I spoke about how important to go through what it's like a checklist of problems that usually these patients at that advanced stage of kidney disease what they encounter, and how do I review their monthly visits. So as I pointed out, I like to see those patients on a monthly basis. I almost treat them. They are like on what we call end-stage renal disease. They are terminally ill with the kidney demise. So in that case, I want to share with you the things that usually we encounter or what we go through a regular visit in those clinics. So basically, I usually recommend those patients to bring me their medication, whether it's their bag of medication or a list, an updated list. They need to bring me also a log of their blood pressure readings. Preferably, they're also their weight readings at home, especially for the ones who are taking a diuretic on a daily basis. And by looking at those two, and while having their monthly labs obtained a couple of days earlier than that, I usually go with all these information, addressing the patient subjectively, and at the same time going objectively with all these parameters, making sure that the patients are stable, which is, I mentioned before, it's the word that I thrive, I like to see, and when I see those patients, and making sure there are no changes in their numbers. So one of those first thing we do, it is actually the kidney function. And the kidney function is based on what we call the creatinine, which is the marker we have in the blood, and what its reflection as a percentage. We keep using the word percentage. It's not a percentage, it's a functioning unit, but we attribute that as a percentage because it gives the patient a guidance. What is his kidney function at this phase? And that's what we call the eGFR. The second one is their blood pressure, which I rely heavily here on their home readings because their home reading will give me a better knowledge through the fluctuation of their blood pressure readings. Usually I'll ask those patients to bring me their morning readings, first thing in the morning. And I look at that and I compare it with the number I have today, which usually is less reliable than the ones they have at home. And I adjust their medication based on that. Number 3 is the anemia. So as I mentioned in the Facebook Live, the anemia plays a big role on those patients. And usually the normal reading for anemia in most labs is usually between 12 to 15. So we like that number to be above 10 for people who has a kidney function less than 30%. So if the number is less than 10, patients sometimes might feel it. They will feel like they are short-winded. They might feel like they are tired. So I try to aim to improve that number around 10 by providing them either iron or hormonal treatment to improve that number and bring it around 10. We don't target a normal number, we target around 10. 4, it's gonna be the parathyroid. The parathyroid / calcium / phosphorus. Those 3, what we call the metabolic bone disease. And in that case, we try to our goal here is to that parathyroid gland that I spoke about, its correlation with the kidneys to keep the calcium and the phosphorus in balanced level in the body. So when the kidney function is less than 30%, this might go up, this might go down, and this will go up. So I have to, based on these readings, while keeping in my mind what's the kidney function, I try to give him the right medicine to bring this down. This will be by diet or by certain binders. Try to stabilize this and try to improve this number to be within a target that we consider as nephrologists is an acceptable target for at this stage of the kidney failure. As you can see, this is a very complicated visit. And I try to, what I'm trying here, try to simplify it to you. It's the same way I try to simplify it to my patients when they come to the clinic so they will be aware. Always my way is to empower patient knowledge. So when they know what's going on, they they know why this medication is in their life. I don't want them to go to the pharmacy and find out there is a medication they're taking and they have no idea whatsoever why this medication is for. For me, I feel that this is something that I did not address properly if the patient doesn't know about it. So that's number 4. Number 5, it's going to be the acidity of the blood. And that acidity, we talk about the pH, and the pH, we look at it, we don't measure it, we look at it because the measuring has to do through blood gas. We measure it through looking at the number in the chemistry. It's called the CO2, which is the bicarb. And if that number is low, we tend to give a buffer, like a pill or a liquid medication. And our goal by doing this is first of all, try to keep this number stable. And the second of all, patient will feel it. They will feel not normal. They will feel something wrong about them when the acidity is quite low. So we try to fix that. Number 6 is their nutritional status. This is a very important one. And we rely on that on several measures. So for instance, a patient with a stable anemia and he's not taking any hormones, that tells me the patient is doing really well. Some of the numbers we rely on the blood for the kidneys has to give me an indication how his nutritional status is. But the one that we rely heavily on in our monthly visits, something called albumin. So for me, albumin is one of my ultimate favorite numbers. It's the number that if you give me, it gives me a lot of insight about what's going on with the patient. If this number is low, that's mean either the patient has an inflammation, either his liver is not doing well, or his nutritional status is really, really bad, or finally his kidneys are just out of shape. He's losing tons of protein through the urine, and that's why the number is low. So this number I use as a very important marker to decide what is the prognosis of this patient, if he either need a dialysis anytime soon, or it's gonna be hopefully many more months he will be fine without the dialysis. Number 7, potassium. Potassium is an element in the chemistry, and that element tends to go up. And something tricky about this element, because the medication that we usually rely heavily to try to slow the progress of the kidney demise, one of the side effects of that medication, it will lead the potassium to go up. So what we do usually is try to keep our eyes on this medication, on this element. So if it's quite high, we try to address it by educating the patient with certain food that he should avoid. And maybe I will have one time a simplified version how to categorize food to know which food that has high potassium or not. However, the potassium is a very important element, and now we're fortunate at this stage of modern medicine that we could actually target that number by a medication on a daily basis to lower it. That will give us more space and more time for the patient to stay away from dialysis. Number 8, it's gonna be his overall condition. And here usually it has a rule with the kidney function. So I want to make sure the patient is able to do the things he likes. He is independent the way he used to be. He's able to sleep. He's still able to enjoy certain food. He's not like just being at home just because he feels like I'm not feeling right. This is all about trying to make sure his condition is very stable. And by keeping those numbers and those parameters at a very stable level, we look always hopeful that the patient will still be able to do what he enjoys the most in his life. Stay tuned. Thank you for watching this, and please subscribe us at Facebook, at Instagram, and those videos will be available on my YouTube channel. Thank you. Have a good day.